We've got question time now, so who would like to start?
Good morning, Bruce Simmons here representing himself but also the ADA and the Public Health Association of Australia. I've got a question perhaps to Martin Durland, and I wasn't sure whether, well, I think starting with Lift the Lip, obviously it's a program where the nurse or the health professional person lifts the lip and looks in the person's mouth. But given the aged care situation, it didn't appear as though there was any looking in the mouth for that. It was, I'm asking that question, and was it more based on asking questions of the person?
The lift the lip does involve, as you said, looking in the mouth. The screening tool for the community living older people was a question-based, 6 question-based screening tool, so there was no looking in the mouth in that situation. However, if we go now to the nursing home assessment tool, oral health assessment and care planning tool, that was looking in the mouth well beyond screening. It was the GP and the RN understanding what healthy tissue and unhealthy tissue looked like with supportive training and supporting materials and photographs leading to the development of a care plan. So that assessment in the nursing home situation is quite more comprehensive in its training and support than is needed for the community living older people, where it was simply a few questions added to the EPC examination by the doctor or the nurse. In the case of the preschool, it involves looking in the mouth, but the assessment is so almost at the trivial level, that's an exaggeration, but almost at the trivial level, that it's at the border between assessment and a screening.
I think the point I'm trying to make in a way is that for anyone who's not a very young child or a very old and disabled person, then by asking that person some questions, that adult some questions, person-centred care you might call it, you can then determine, or that person can then determine for themselves and for the professional where they see their oral health at that particular moment. And then, from what you were saying, if that person was then able to, and did appear as though those people who were advised that they could seek care through the enhanced primary health care program, that I'm interested to know what percentage of those people took up that opportunity and had completed courses of care. Looking at your diagram, it seemed pretty clear that given the opportunity, a majority of those people, having identified for themselves they had a problem, could then access care and address their problem themselves.
Certainly when a person is well and in the community, say a community living older person, they were the easiest group to deal with because it was a simple pathway between questions, recognition there was need, assistance with the pathway, they could manage it themselves. That was certainly the case. That was the person managing their own care with support.
Hello, it's Pat Alexander. I'm the Educational Manager for the Community Services and Health Program at Gillis Plains, and part of my portfolio covers the dental studies area, the Centre for Dental Studies. My question relates to how we're going to integrate this training into the aged care training, because we see that this is very much about trying to bring down the barriers between the silos of the different areas, and we've been working towards that at Gillis Plains campus, where we do have our dental hygienists involved in the training of some of our aged care students. So we're very interested in using that product to really reinforce and support the training of our aged care workers. So are those products going to be made available to training providers?
One of the things that the Industry Skills Council can do, or the training packages themselves can do, is actually structurally promote and make available the things that are already happening to the broader vocational education and training system. So again, reflecting back on what the outcomes or key products of our project is going to be, they are going to be some competency standards that can be included, for example, in the community services training package and available to package into an aged care work qualification, a Certificate 3 in aged care work, for example. Now, I would say that some of the work that is being done now that Martin's alluded to and that some of the priorities that Glenn has alluded to, the competencies should be reflecting what some of that work actually already is. Now, when we get the competencies into the package and have those competencies endorsed by the National Quality Council as new additional recognised competencies, then they're available for any registered training organisation to package into the delivery of their aged care qualifications, or they're available for registered training organisations to develop up as potentially a skill set or a short course for recognised skills for aged care workers. So what we do with the packages is we actually, at a national level, we actually facilitate production of resources and delivery of training via the vocational education and training system. So in many ways, this is just a starting point, but an important starting point, and it's a point at which, again, any registered training organisation can commence to deliver those competencies or qualifications and thus give greater effect to a wider range of services that could have a real impact.
I guess just in comment on that, I'd say that it's critical that we can start this as soon as possible, because what we want to try and do is not only with the rollout of the project that's happening shortly at training the RNs in aged care facilities, but also if we can train up a Certificate 3 in aged care workers now, we'll be bringing through a pool of people who have the skills to carry out the care plans on the ground, so that we're coming at it from both ends. So I really would like to see that and we are in fact trying to embed that into our programs, because it does come under the personal care unit already, but it's not beefed up enough.
Well, just a quick comment on that. Look, in terms of the project we're doing, I wouldn't say don't wait for it to finish. Continue on with developing the oral health skills of aged care workers, and again, a significant benefit around the system in that we develop the standards and delivery happens elsewhere is that the standards themselves can be used to assess existing workers and their existing skills. So you can be skilling people up, and then when we finish completion of the standards, then those people could receive an award for their existing skills, and that can be added to their skills passport and their career and their professional development in the context of oral health skills.
And could I say at this point, our role in terms of the implementation of training packages gives us an opportunity to work with groups and lead some of the training providers in terms of helping them understand strategies and the importance of that, embedding it in aged care and other areas. So I guess from today, it's useful for a number of us to actually look at how we might do that and start fairly soon.